Hello, I am Dr. Emily Wirtz, plastic surgeon in Cleveland, Ohio. This video is meant to be an educational video for my patients who are sent home from surgery with drains. If you are not a patient of mine, please keep in mind that there are many different types of surgical drains and to check with your surgeon prior to following the instructions in this video. First, let's go over the materials you will need to help you take care of your surgical drain. These are handy things to have at home before you're sent home from your surgery. You'll be sent home with your surgical drain, which consists of a plastic bulb, a plastic tube that's connected to that bulb, sewn into the skin with a suture near that black dot, and then the drain that sits below the skin and the surgical site. The drain helps to drain fluid out through that plastic tube and into the collection bulb. You'll be sent home with a measuring cup with a lid so that you can measure the drain fluid and then secure the lid to transport the fluid to the toilet for disposal. A pack of sterile gauze is handy to have to help clean up any mess or drips that are associated with the surgical drain. In addition, the gauze, tape, lanyard, safety pin, and even a Band-Aid may be helpful to secure the drain tube to your skin and the bulb to your garments. Whenever handling drains and body fluids inside of those drains, please use disposable gloves. Remember to wash or sanitize your hands before putting gloves on and after taking gloves off. Alcohol pads can also be helpful for cleaning the drain as well as milking the drain tube. Finally, have a pen and your drain log handy. This drain log is the sheet of paper provided to you by your surgeon's office to keep track of the output. Your drain has a soft plastic bulb with a stopper and is attached to a soft, flexible tube. The drain is placed into your surgical site through a small opening in your skin, and a suture holds the drain in place. The rest of the tube extends from the surgical site leading to the bulb. When the bulb is compressed, it creates a gentle suction that helps to remove extra fluid that your body makes after surgery. The bulb itself has a port where the drainage tube empties. This port has a one-way valve to prevent any fluid that's collected in the drain from running backwards into the tube. It also has a stopper here that either unplugs or, in this case, unscrews to allow you to drain the fluid from the bulb. Make sure that both the screw and the port for the drainage tube are always sealed nice and tight. The drainage bulb usually has numbers marked along the side of it. These numbers measure milliliters of fluid and are helpful when you empty and measure drainage from the bulb. The other thing to note about your drain bulb is that it usually has a tab next to it. This tab is helpful to secure your drain to your clothes using a safety pin, clip, or a lanyard. The last important part of your drain to know about is this black dot. This dot is located nearby the holes or channels in the drain that collect the fluid from the surgical site. If this dot is out of the skin by more than an inch, your drain may not hold suction well. This is because those holes may be close enough to the skin to collect air from the outside rather than fluid from under the skin. If the tube ever tugs or pulls, always check to see whether the black dot has moved significantly or if the drainage holes are exposed. Every time you empty your drain, you should record the amount in the drainage log. If you have more than one drain, make sure you fill out the correct sheet for the drain you have emptied. These might be labeled by number, left or right, or by body part operated on, such as left breast or right abdomen. Record the date that you have emptied the drain, then record the output in the box for the appropriate time of day, such as morning, afternoon, or evening. If you empty the drain more often than this, that's okay, but make sure you add up all of the numbers for one day into the last column to get a total output for that day. I recommend you record the output in milliliters rather than ounces. Some people find that it's also helpful to record the color or quality of the drainage, but this is not necessary to do. Milking, otherwise known as stripping the drain, is something you should do 2 to 3 times a day and each time you empty the drain. Milking removes clots and particle buildup along the drainage tube. If there are any blockages along this tube, the suction doesn't work as well, and it could result in buildup of fluid at the surgical site. To milk the drain, put on gloves, and I recommend using an alcohol prep pad to make your fingers slide easier along the drain. Start by grasping the tube firmly with your thumb and forefinger near the suture holding the drain in place at the skin. This is your anchor hand. Always start closest to the body. Then grasp further away from the body with your other fingers using the alcohol swab. Now squeeze the tube, pushing fluid away from the body with this alcohol swab. Keep your anchor hand firmly holding the tube while you flatten the tube. Work your way away from the body and towards the drain bulb, always keeping an anchor hand on the part of the tube closest to the body because this avoids pulling the stitch or pulling the drain out. To prevent the drain from tugging or pulling where the tube is sutured to the skin, and to prevent the drain from being pulled out too early, it's important to secure the drain bulb to your garment. There are a few ways to do this. The first is to secure the drain by using this clear plastic tab. You can fix it to a lanyard, which is particularly useful while you shower, or have multiple drains to keep track of. You can also use a safety pin. To do this, open up the safety pin or clip and place it through the clear plastic tab. Before closing the safety pin or clip, attach it to your garment. With either of these methods, you will always know where the bulb is and have a low risk of pulling on the drain. To empty your drain, have your gloves, cup with lid, drain log, pen, and some gauze available. After washing your hands and putting on gloves, remove the cap from your measuring cup and unclip your drain from your garment. Remove the stopper from the drain to let the suction out of the bulb. Then you may hold up the bulb to measure the fluid against the numbers marked on the side of it. If you are unsure how much fluid is in the bulb based on this technique, then you should use a cup with measurements on the side. Next, empty the bulb into the cup. When all fluid has been removed from the bulb, squeeze the bulb flat and replace the stopper with your hand still squeezing the bulb. When the stopper is nice and tight, you should secure your drain back to your garment. Next, place the lid back on the cup and transport the fluid to the toilet to dispose of. Remove your gloves and wash or sanitize your hands. Remember to record the output in your drain log and to milk your drain each time you empty it. If your drain has stopped putting out fluid, this may just mean that your body is not producing fluid for the drain to pull out. The other possibility is that there may be a clog somewhere along the tube that is blocking fluid from flowing out. The best way to make sure that this isn't happening is to milk the drain. If your drain output has been decreasing over the last several days and no fluid is coming out, it may mean that your drain is ready to be removed. Go ahead and call our office and we can schedule an appointment to get your drain out. If there is drainage coming from around the tube where the tube inserts into the skin, it may be because your drain is clogged. Make sure you're stripping the drain multiple times a day to pull out any clots or blockages that could be causing a buildup of fluid behind the drain. As long as your drain is still pulling fluid into the bulb, it's working. Make sure you're still stripping it and then place a gauze around the insertion site to collect any stray drips of fluid. If your drain bulb doesn't hold suction, there are a few things to troubleshoot, and you can watch my video about troubleshooting drains at the link down below. The first thing to look at is to check that the black dot has not been pulled out too far from the skin. Make sure the black dot on the tube is within 1 inch of the skin. Next, make sure that the drain port where the tube is connected to the bulb and the stopper are both tightly secured to the bulb. If everything looks okay from that standpoint, the next thing to do would be to assess the tube itself for any holes. To do this, squeeze down the drainage bulb and listen along the tube to see if there's a rush of air or a little squeak that would suggest there might be a hole. If you do find a hole, or if your drain still doesn't hold suction after inspecting the drain, make sure you call our office to see if there's anything else we can help you with. It can be very normal to have more than just fluid in your drain. For example, long, stringy clots that can settle in the drainage tube look like long, stringy noodles that are red when they get milked into the drain. This is very normal. The color of the fluid in your drain will change over time. At first, after surgery, the drain is going to look dark and maybe even bloody in appearance. If it stays thick like tomato soup for longer than a day, make sure you call your surgeon. After this, your drain should start to thin out and lighten up, finally looking more orangey or yellowish. That suggests that you're getting close to the time when that drain is ready to come out.